Welcome to the Relationship Toolbox, a show about communication skills that we need in order to build healthy relationship with others. And when we say relationship with others, that could mean our healthy relationships with our partners, our children, our extended family and friends, employers, colleagues, our care workers, neighbors, teachers, pretty much anybody that we have regular contact with in our daily lives. Today, we're taking some precautions in the studio due to the virus, and we are limiting the number of people on the set, so Tom will not be with us, but he'll be back next time. I am joined today by a guest, and her name is Stacy Shortle, and she serves as the school psychologist at the Rutland High School. And she's going to help us understand what researchers are calling adverse childhood experiences. Sometimes they shorten it and they say ACEs. And these adverse childhood experiences can affect our relationship with others. So welcome, Stacy, for being here today. And this term, adverse childhood experience, or ACEs, might be a buzzword in education or in the healthcare, mental and physical healthcare, but a lot of people aren't familiar with it. So would you be able to just tell us what it is, and then we'll talk about the effects?
Thank you for having me.
Oh.
And before we start to talk about ACEs and what it is, I just want to make the viewers mindful that it could, the discussion that we have could bring up some uncomfortable feelings or some reflections on memories from our own developmental periods in early childhood. So just want to have folks be mindful of that, and to think that we are going to be talking about the hope and the resources that are available if people want to find out more information or get some extra help to help manage their
that's always
their
important
experiences.
when we're talking about any kind of trauma, that it can conjure up old stuff. So what are they? What are adverse childhood experiences? We all have bad experiences. What are these? How are they different?
Yeah. So ACEs, as we refer to them, or adverse childhood experiences, are potentially traumatic events that are experienced during the developmental period. And when we say developmental period, we're talking from birth, even prenatally, up to about age 18. And they were first discovered, or the research dates back to the 80s and 90s. And they could refer to a host of different events that, and I want to make sure that we're also aware of the fact that they don't cause later challenges, physical, mental health problems, but they're highly correlated, or they're risk factors.
So they're predictors.
They're predictors,
but
yeah.
it isn't.
It's not cause and effect, right. So some of the experiences that children have in their developmental period, the researchers found that later leads to or could put them at risk of having physical, medical problems later on in adulthood, mental health problems, relationship problems, work-related problems. So it's a pretty significant undertaking that was done back in the 80s and 90s to put this information out there and to put the research out there. Some of the things that we see in later adulthood physically could include things like cardiovascular problems, diabetes, significant asthma, cancer, strokes, from the behavioral side of it, mental health, certainly depression, anxiety, post-traumatic stress disorder, substance abuse, alcoholism, relationship problems, and, even, productivity at work, missed days because of physical issues or because of behavioral, choices that people make, or just because of the fact that they just can't carry out the job.
Wow. So here, with this research, here is yet one more reason to be mindful of how we're interacting with our kids. So not only to minimize what's going on in the moment to keep them from harm, but because it has such a long-term, enduring effect. Wow. So how was this discovered? You say it's been studied since the 80s and 90s.
Yeah,
so.
it's absolutely, it's a fascinating story. So there was a physician, a researcher, a clinician by the name of Vince Folletti, who worked in San Diego, and he was running a preventative medical clinic, and he was managing an obesity clinic. And the patients that he worked with were significantly obese, so maybe 100 to 600 pounds, the study said,
Wow.
overweight. So he would work on weight reduction programs for these adults. And what he started to question, and it was puzzling him, was that when people were making progress in losing weight, they would drop out of the program. And he was really curious about that. So he started calling people after they dropped out and did some informal questioning and asking them what was going on. And then he started to think a little bit about their early experiences and asking, well, what weight were you when you were born? How much did you weigh when you entered school, when you entered high school?
So tracing back these
kind
things,
of
like
backtracking.
what's going
yeah.
on now may have had some
Right.
trigger in the past.
And there was
Okay.
one question that he asked about sexual activity, and he typically would ask the question, how old were you when you became sexually active? And for one patient, he misspoke, and his question was, how much did you weigh when you first became sexually active? And the woman responded, I was 40 pounds.
Wow.
And exactly, he thought about it, and then he said, oh my gosh. So she disclosed the sexual abuse that she had experienced when she was 4 years old.
Wow.
And how, and what he found too was that the people that were in his clinic didn't gain weight gradually, but it was more abrupt. So he started to call more of his patients that dropped out of the program. And what he was asking these questions, he was finding that there were many similarities of these adverse experiences in early childhood. And I think he interviewed probably around 200 people, if I recall from the study. And he was gathering all of this information that these people in his clinic had experienced in early childhood. So he started to think about it, and he published some research, and it was questioned, it was criticized, because in the medical field it was still a stigma, mental health,
It's harder to measure, I think, because it's not as concrete.
Right. So what happened was he was connected with another physician with the CDC, and they collaborated, and they conducted a massive study. About 15,000 people, I believe, was what they targeted.
I've read over 25 years.
Yeah,
they
25
collected
years.
a lot of data. Yeah.
And they went, they phoned people and had people fill out information, and they answered questions. And long story short, it all boiled down to what we now know as the Adverse Childhood Experiences Survey.
So tell me about the survey. What do they ask?
So there's the original survey has 10 questions, and the questions pertain to experiences and again in early childhood, in that period from 0 to 17 or 18, the experiences of physical abuse, sexual abuse, neglect, emotional abuse, and then other factors, including mental illness in a parent, suicidality, incarceration, divorce, substance abuse. And so those are the specific questions that were on the original study, but since it's expanded to include other questions pertaining to community violence, racism,
because that carries
immigration,
its own load that may not be specific to your family, but it's a societal
massive disasters as well,
Right.
that more currently researchers are looking at, that this can have a huge impact on the developmental period.
Wow. So what are some of the lasting symptoms? What are some of the things that come up that might interfere with a person's ability to be in a relationship or to handle a job or to have anxiety in school? What are some of the things that surface?
Okay. I think right at this point, it's we all experience stress.
Right.
We all do. I'm walking into the building, I'm thinking, oh my gosh, I have the jitters, I have butterflies, but what I do is I breathe and I say it's going to be okay. So that's what we call positive stress. And every one of us has positive stress on the daily, and we have the coping skills and the resources.
Makes me meet deadlines.
Exactly. It
Stress
keeps
will
us
get
motivated,
me.
right. And so that's that positive stress that helps us do what we do. And then there's the next level is what we refer to as tolerable stress. And these are more significant instances, include a loss, a separation, something, a significant event that has an impact on us, but we're able to work through it. And typically in those situations, we have a significant other, a relationship, somebody there who helps us buffer the stress, whether it's a parent, caregiver, a significant other, like I said, a teacher, could be anybody, but the point is that there's a relationship there. And then when we think about the next level, which is toxic stress, which is really what ACEs looks at, is the experience of these adverse childhood experiences over and over and over. It's chronic. And there's a lack of that buffer, the lack of that relationship in the child, experiences, like you said, some, learning problems, behavior problems, long lasting. Again, it transitions into, without intervention, those physical problems like I referred to earlier on, health problems, obesity, cancer, strokes, heart disease.
When I have read about this or heard from you, I'm just so astonished that decades after this has stopped, after the national disaster or after the abuse or after removing yourself from a dysfunctional situation, you still have captured this trauma in your body and are affected by it. It's like it's not a quick fix.
No, it's not. It's lasting.
And I'm also, when you're talking about it, when we were putting this program together, initially I was thinking, well, this is about our families, it's about our children, about ourselves, and about the people that we interact with on a regular basis. But when you talk about society and how they've included these other measurements of immigration, of racism, of natural disasters, I'm thinking about family separation at the border and how traumatic that could be, and that knowing this information, it might influence policymakers as well, not just parents and teachers and partners, but it might shape how we interact as citizens and as friends. Wow.
Yeah.
So the things that are happening to a 4-year-old now are going to affect them when they're 44.
Without that intervention,
without the buffer,
So there's a pediatrician by the name of Nadine Burke-Harris in California, and she started a center for youth wellness, and she was it was in an underserved, under-resourced neighborhood in San Francisco known as Bayview Hunters Point, and so she started a clinic there, and many children were coming into the clinic, and the number one referral was for attention deficit hyperactivity disorder, or ADHD, because of the behavioral symptoms they were exhibiting, the hyperactivity, they're impulsive, having a hard time with focusing. And she was really reluctant to just write a prescription for Ritalin, knowing that this is kind of weird that there's a lot of these referrals happening. And so she started asking those questions. And this was before she knew about ACEs. This was in the early 2000s. And what she found was that the more she developed a relationship with her patients and the families, and looking at the research that was done on the original ACEs study, she started asking those questions and finding that it wasn't just a behavioral manifestation of symptoms of ADHD or a skin rash or asthma that she needed to treat, but really looking underneath at the root of where the difficulty started or where the behavior started. Persistent, yeah.
And that prescribing a medication might mask it, but it wasn't going to take it away. So I understand that you are doing some work in the school system, where you are, to implement trauma-informed instruction based on this research and awareness. So what does that look like, and why is it important? And maybe how would it look different in different schools?
Sure. So it's important because we know that Dr. Burke-Harris refers to it as a dose-dependent relationship. So the higher the exposure or the higher the ACEs score, the increased risk for learning and behavioral problems in children, and then the further risk for physical and behavioral challenges as adults. So what the research shows is that about if a child has an ACE score of a 4 or more,
4 out of
10.
4 out of 10. Okay.
What they've found is that there's about a 30% increase in learning or behavioral problems in school.
Okay. So if they've reported that there was a divorce or neglect or abuse or dysfunction, and they've answered 4 questions out of the 10. They
Affirmatively, then they're at higher risk of having some problems or some challenges in school. So we are. I was fortunate to be awarded I applied for a Rowland Fellowship through the Rowland Foundation in Londonderry, Vermont, and the fellowship is going to be looking to provide teachers with tools in the classroom settings to, through the trauma-informed lens. So looking at creating a sense of safety for students to be able to then engage in learning, because what the research also shows too is that it's not just the experience of the event that happens, but if it happens over and over again, there's physiological changes. So a child is in a constant state of fight or flight.
Right. You're alert.
Like you're hypervigilant.
I'm trying to not be traumatized.
Right. Acting out, aggressive, that fight or flight response, which then in turn impacts our ability to engage in learning. It impacts the amygdala of our brain, which is the fear center, which gets in overdrive and is constantly, like you said, is hypervigilant. We're on alert. We're seeking out whether our environment's safe or not.
So are you suggesting to implement this informed practice for everybody, or are you identifying certain kiddos that might be more susceptible?
So there's different levels of supports that we're implementing. So in the educational world, we refer to it as a multi-tiered systems of support, or MTSS. And so the idea is, just like in the medical world, there's universal strategies that we implement. So teachers are going to be provided with tools to explore, to implement in their classroom settings, to help their classrooms be a safe space for students, and then to be able to engage in a relationship and to be able to provide that sense of safety and connection that students need, that they may not be experiencing outside of the school environment. So that's in the classroom setting. And then there's strategies that we're going to be learning and exploring to help engage in that learning process. So once the safety is established and the relationships are established, that makes us more available to engage in the actual learning and instruction process.
Right. So when you talk about safety, I think people think about like falling objects and the arrangement of the furniture. What are you talking about in terms of it being safe in the classroom?
Yeah, it's physical and it's emotional safety. So it's just a series of strategies that teachers can employ when a classroom, in a classroom environment. So a lot of it focuses on being able to keep kids in the present and ground themselves. Maybe exploring some meditation sorts of practices or mindfulness activities that can create that safe space where students can then be able to engage their brains to learn.
Okay.
So that's in the classroom setting. And then if we have a system of support, like I said, and there's going to be some more focused interventions that are going to be available for students who are having difficulty through like small group interventions, check-ins with a staff member, with an adult, a support service staff member at the high school.
I would imagine that just contemplating this survey could be difficult. Is it adapted for different levels of development in terms of when you're trying to speculate whether a kid has been traumatized? I mean, how do you even go about the implementing the survey? Will that be something that is given to kids?
We may not necessarily implement the survey. I typically will explore those questions if I'm conducting an evaluation with a student or with a family, just to think about early experiences that might contribute to some behavioral or some learning challenges. I know that the medical community is looking at trying to make this ACEs survey universal for all well checks. I know they do it in California in the Center for Youth Wellness, and they've seen some pretty amazing benefits of being able to identify some of those early experiences and provide effective interventions. But at the school level, these classroom strategies are applicable for every student,
Right.
And every adult in every classroom. And
So
then
best practices for
practices.
the folks who might be suffering or having residual effects of these traumas are also good for everybody in the
Absolutely.
class. And not only that, but if the kids who are having trouble focusing and maybe acting out can be guided either through meditation or given space to work something out, then the learning for everybody is better in
Right.
the classroom too. So, what about like parents? We can't always, we try, we all want the best for our kids, but sometimes we can't keep them from these things. What could I do as a parent or a grandparent or an extended family to communicate and interact with somebody who may have had these stressors?
I think one of the most important things is for adults to be aware of their own, triggers or experiences, because if we're not able to take care of ourselves, it's going to be really hard to take care of others. So recognizing, and it doesn't have to be necessarily like an early experience. It could be, stressors of just life as a parent or life, in general. But us being aware of our own stressors is really, really important, because when we're working with students or children or other adults who have experienced this toxic stress that we're talking about, like I said, they're hypervigilant and they're picking up on those cues. And if they're sensing stress or not a safe situation in someone else, then it could then trigger them to engage in that fight or flight response. So, some students act out, some students are aggressive, they're verbally aggressive, some students turn inward and try to kind of flee, the fight or flight. And I think from an adult perspective, we need to understand that behaviors are a mode of communication. And if there's one thing that we can do is kind of change the lens through which we look at those behaviors, from what's wrong with you to what happened to you. And just that simple switch will shift the way we look at behaviors and think about, this is not a choice or something that a child may be engaging in voluntarily, but it could be as a result of something else.
It's a manifestation of
right.
something that they're dealing with. So let's just talk about that, because we have mostly spoken about children and how to build capacity and resiliency in children. But here we are walking around in adult bodies, and we may be carrying this. How do we take care of ourselves, particularly when we're talking about these physical symptoms that could be a result of high scores, let's say? What do I do to mitigate diabetes or heart disease or COPD or depression? I mean, what can I do now at this age, which I'm not going to reveal, but to maybe offset some of that trauma that I may have had,
Right.
toxic trauma?
So there's always the question, okay, I know my A score, what do I do? And it's not, the score is not the destiny. The score is not, does not mean that everybody's going
this is
to
gonna happen
be
to me,
happening.
right.
Yeah, because there are some people who have these high A scores who don't develop, these physical problems later in life, and there's some people
Who are more susceptible.
and there's some people who don't have,
Right.
who have an A score of 0, who
Well, maybe,
have these physical
and maybe they also
challenges
had
or-
buffers.
Right,
Because you were talking about these
exactly.
people who can kind of minimize the impact of the toxic stress.
Right.
So what do I do for myself? What kind of self-care?
So certainly, self-care is another buzzword out there right now, given, what we're all experiencing. And, it's the old metaphor of the flight attendant teaching us how to put
Yep.
our masks on. And it's so true, that's what we have to do. We have to be able to take care of ourselves so that we're able to take care of our, our children, our students, our spouses, our coworkers. So, I think going back to the, the original question, if adults have these physical symptoms or physical conditions, certainly medical advice needs to be sought and medical interventions. If we think we're at risk, reaching out and engaging with mental health supports are really important. But through the work that's been done with Nadine Burke-Harris and a lot of the ACEs organizations out there, they really have found and recommend that the mindfulness activities are really important, because the physiological effects that even just deep breathing has on that arousal system
And stepping
helps to calm
away
us, step
and just
away,
be
right?
present, yeah.
That effective, sleep habits,
Sleep.
getting
Sleep, right.
really consistent, and the recommended 8 hours of sleep
Yeah,
a night is
they're-
really important.
I'm finally ready to conceive there might be some connection between that. So we're almost out of time, but I wanted to just kind of recap. I know we could talk for hours or days about this, but when you're talking about building capacity in yourself, Tom and I are often on this show talking about people in conflict, and it's hard when you're in conflict to keep that in mind. But what you do to be aware of your situation can perhaps prevent one of these childhood traumatic experiences, adverse experiences. So regardless of whether you are the person who potentially could be creating one of these ACEs for somebody that you love, but inadvertently, or whether you're a bystander in a family, it's good to be aware of these, aware that this happens and it has long-term effects. Or if you are somebody in this child's life, be that buffer. Be the coach, the teacher, the neighbor, the aunt or uncle that can maybe ease this and lessen the effect. If it's your partner, your life partner, understand that you can still make a difference, that these symptoms are not a sentence. And if it's you, if it's yourself, say, okay, it's not too late for me to buffer for myself.
Right.
I'm aware of this now, and this is what I could do to be healthier and happier. It's really good to know that it's just a forecast. It's the old nature, nurture, although these are kind of a combination.
They're intertwined, absolutely.
This is because of your nurture or because of your environment, this becomes a physical thing. So where could people learn more if they want? Do we have just like 1 minute left?
Okay, 1 minute left. Certainly, if you have access to the internet, I would go to the CDC website, the Center for Disease Control. They have an ACEs facts, prevention, intervention. The Vermont Department of Health it does its own work in Vermont. Certainly at a local level, reaching out through the United Way or mental health
doctor,
services, physicians,
school psychologists,
absolutely. The school.
Great.
There's tons of resources out there, and I encourage anybody who wants to learn more about it or to start to see some help to just reach out to some of those organizations I just mentioned.
Well, thank you, Stacy,
you.
and thank you to our audience for joining us to learn more about adverse childhood experiences with people of all ages and the things that you can do to handle it. So we will see you again on the Relationship Toolbox. Thank you.